Most preppers don't die from gunfights or ambushes. They die from 5 simple, preventable injuries that kill fast when help isn't coming. There are no warning sirens, no dramatic music, no clear moment where normal officially becomes disaster. One day the systems work, the next day they don't, and when that happens, the injuries that kill people aren't cinematic. They're quiet, they're boring, and they're fast. I'm Suburban Prepper, Desert Storm and Afghanistan combat veteran, former 160th SOAR medic and nurse practitioner. I've treated trauma in war zones, disasters, evacuations, flight missions, and blackout conditions. I've watched fragile systems collapse under real pressure, when command disappears, when transport stops, when hospitals overload, when weather, violence, or simple chaos delays help long enough for small problems to become fatal. Today, I'm breaking down the 5 injuries that actually kill preppers in real life, during blackouts, winter storms, riots, or full system collapse. Stay with me to the end, because when you understand these injuries, you stop prepping for fantasy and start prepping for reality. Injury number 1, uncontrolled bleeding. This is the number 1 preventable killer in any emergency. Once severe bleeding starts, you are immediately on a clock. Not hours, not minutes, seconds. Arterial bleeding can take a life in under 90 seconds. I've seen this from chainsaw accidents in backyards, from jagged sheet metal during storm cleanup, from broken glass in dark houses, from accidental gunshots during rushed handling, from vehicle rollovers, from collapsed structures. This is not a battlefield-only problem. This is a homeowner trimming trees alone, slipping and severing a forearm artery. No neighbor home, no ambulance access, no warning beyond sudden warmth and confusion. Most preppers own tourniquets. Very few train with them under stress. Here's what correct looks like. Apply high and tight on the limb. Crank the windlass until bleeding fully stops. Ignore the screaming. Pain means the artery is compressed. Mark the time clearly. Do not loosen it casually to check. Here's where preppers get this wrong. They place the tourniquet too low. They don't tighten it enough because the pain makes them hesitate. They loosen it repeatedly and restart bleeding. Or worse, they delay using it at all because they're afraid of doing harm. Modern tactical combat casualty care and tactical emergency casualty care guidelines are clear. Properly applied tourniquets rarely cause limb loss when used for reasonable durations. Ideally, convert to a pressure dressing within about 2 hours if bleeding can be controlled and evacuation is possible. Truth or false? Tourniquets destroy limbs. False. The decision clock here is brutal. You either stop the bleed fast or the body empties itself. For combat-proven tourniquets I trust, check my Suburban Prepper storefront, and if you don't have a real medical kit or don't know what actually belongs in one, watch my video, 5 IFAKI mistakes that will kill you. Injury number 2, airway compromise. This one kills quietly. No blood everywhere, no panic at first, just silence. Once the airway closes, you have about 3 minutes. I've seen families choke on food during blackouts when lighting was poor and stress was high. I've seen people collapse from indoor propane heater smoke inhalation. I've treated severe allergic reactions that turned fatal because epinephrine was delayed. I've seen unconscious patients whose own tongues blocked their throats. I've seen burn victims whose airways swelled shut after they initially seemed fine. This is another injury where hesitation kills. Every prepper needs airway fundamentals. For food choking, the Heimlich maneuver. No gear, no excuses. For unconscious patients with suspected spinal injury, the jaw thrust, hands along the jaw, lift upward, pull the tongue forward without tilting the head. Nasopharyngeal airway, or NPA. This is one of the most underused life-saving tools available to civilians. It's easy, it's safe, and it's tolerated even when the patient still has a gag reflex. Size from nostril to earlobe. Lubricate generously. Insert into the right nostril with the bevel toward the septum. Advance straight back, not upward. Twist gently if needed. If it resists, switch nostrils. Oropharyngeal airway, or OPA, only for fully unconscious patients with no gag reflex. Size from mouth corner to earlobe. Insert upside down, rotate 180 degrees as it advances. The flange rests on the lips. Never use this on someone with a gag reflex. They will vomit, aspirate, and often die. If trained and legally equipped, epinephrine auto-injectors save lives in severe allergic reactions. Blue to the sky, orange to the thigh, it can reopen the airway temporarily and buy time. Common prepper mistakes here are deadly. They panic and do nothing. They tilt the head on trauma patients. They own airway gear, but never practice inserting it. They wait because it feels invasive until it's too late. Once the airway is gone, there is no catching up. Injury number 3, infection. This is the slowest killer and the one people underestimate the most. In grid-down conditions, infections explode. No hospitals, no intravenous antibiotics, no sterile operating rooms, dirty water everywhere, tiny cuts, burns, punctures, animal bites, or poorly closed wounds can kill in 48 to 72 hours. I've seen soldiers nearly lose limbs from wounds smaller than a paper cut. Here's the danger. On day 1, the wound hurts. On day 2, it looks better. Less pain, less redness. People relax. On day 3, the infection moves into deeper tissue planes where you can't see it. That's when fever starts. That's when confusion appears. That's when the clock accelerates. Cleaning is everything. Do not dab. Do not gently rinse. Irrigate aggressively. Flush hard with clean water, sterile saline, or Dakin solution. Dakin solution is old school, combat tested, and effective. 1 liter of clean or boiled water, half a teaspoon baking soda to buffer, 3 to 5 milliliters, about half to 1 teaspoon, of unscented 8.25% household bleach. No splashless, no scented. Mix fresh. Use within 48 hours. Make small batches. This is where people die. They close dirty wounds too early. They rely on antibiotics without cleaning. They assume clear water is clean enough. They ignore worsening pain because it doesn't look dramatic. Keep tetanus immunizations current. Every 10 years or sooner for dirty wounds after 5 years. Tetanus is often fatal without intensive care. Antibiotics are not magic. Clean first, then treat. Cephalexin for skin infections, doxycycline for bites and tick exposure, amoxicillin or augmentin for mixed infections, metronidazole for deep anaerobic wounds. Tea tree oil can help as a mild natural antibacterial or antifungal on minor edges, but it does not replace irrigation or antibiotics. Red flags you cannot ignore: fever, red streaks traveling up a limb, hot or hardened skin, swelling, foul odor, confusion, worsening pain. That's cellulitis or sepsis. If care exists, you go immediately. Injury number 4, hypothermia. This one kills quietly and early, even at 50 degrees Fahrenheit, especially when someone is wet, exhausted, malnourished, and exposed to wind. Water pulls heat from the body about 25 times faster than air. This isn't just a wilderness problem. This is storm cleanup, flooded basements, power outages, vehicle breakdowns. Remove wet clothing as soon as it's safe. If you're exposed to wind, get shelter first, then strip and change. Insulate from the ground. Pads, blankets, jackets, leaves, trash bags stuffed with clothing work surprisingly well. Block the wind aggressively. Passive rewarming means dry layers and insulation. Active rewarming means warm packs or bottles wrapped in cloth placed on the core. Chest, neck, groin, armpits. Never warm the extremities first. That causes afterdrop, cold blood returning to the core, and can trigger cardiac arrest. If the person is awake and able to swallow, high-calorie foods and drinks, honey, peanut butter, trail mix, sugary warm fluids, calories equal heat, never rub cold skin, you damage tissue and worsen injury. Danger signs: shivering stops, confusion worsens, irregular heartbeat, they want to sleep. That's when people die. Injury number 5, heat exhaustion and dehydration, including heat stroke. This is the summer killer. Grid down means harder work, more sweat, less water, and rapid electrolyte loss. Heat stroke can kill in under 1 hour. This is roofing repairs, debris clearing, gardening, carrying water, all while stressed and underfueled. Move to shade immediately. Remove excess clothing. Cool the core with wet cloths on the neck, groin, and armpits. Fan aggressively. Avoid ice immersion unless advanced care is available. It can shock the heart. Homemade oral rehydration solution. 1 liter clean water, half a teaspoon salt, 6 teaspoons sugar. Sip slowly over 30 to 60 minutes. No measuring tools. 3-finger pinch of salt, 4-finger pinch of sugar per bottle. Add potassium when possible. Coconut water, light salt, or electrolyte powder. Use work-rest cycles. 15 minutes work, 15 minutes rest. Red flags you must treat as emergencies: stop sweating, confusion, vomiting, rapid heartbeat, seizures, collapse. That's heat stroke. You do not wait. Midpoint reality check. Movies teach people to fear bullets and explosions. Real disasters kill with silence, blood loss in the dark. Airway swelling while someone sleeps. Infection that doesn't hurt until it's fatal. Cold that feels uncomfortable until it isn't. These are boring deaths, and that's why people don't train for them. Final reality. Check. Bleeding. 90 seconds. Airway loss. 3 minutes. Infection. 48 to 72 hours. Hypothermia. Even above freezing. Heat stroke. Under 1 hour. Notice the pattern. The fastest killers don't announce themselves. The slower ones punish neglect. Every single one rewards early, disciplined, boring action. Training beats gear every time. Medical skills beat weapons. Early intervention beats heroics. Truth or false? Tourniquets destroy limbs. False. Clear water is always safe for wounds. False. Hypothermia only happens below freezing. False. Small wounds can't kill. False. Survival isn't about firefights. It's about mastering these quiet, fast killers. Now you know them, and that knowledge puts you miles ahead of the average prepper. This is survival. This is resilience. This is Suburban Prepper.